Welcome to RUMC Vital Signs. My name is Alex Lutz. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit www.rumcsi.org. Richmond University Medical Center is Staten Island's leading provider of behavioral health and addiction services for children, adults, and adolescents. And their services are in high demand when it comes to opioid addiction. Nearly 1,000 people have died of opioid overdoses on Staten Island alone since 2016. From 2021 through 2023, around 80% of the people who died from an opioid overdose on Staten Island had fentanyl present in their system. From 2000 to 2012, fentanyl was present in only 2% of drug overdoses. Joining me to discuss this alarming situation and services available through RUMC to combat opioid addiction is Ileana Acosta, Program Manager for the Adult and Adolescent Substance Abuse Programs at Richmond University Medical Center. So thanks for joining me.
Thank you for having me.
So let me start by asking, what has been some of the reasons for this surge in opioid use here on Staten Island that's obviously leading to the overdoses here on the island?
That's a great question, and I think that I'd like to start, and I know most people probably already know what opiates are, but just to kind of go over the basics.
Sure.
Opiates are a class of drugs that work in the brain to produce a variety of different effects, including pain relief. Opiates include the illegal opiate, heroin, synthetic opiates such as fentanyl, and prescription painkillers. So examples of prescription painkillers include oxycodone, morphine, Vicodin, Percocet. Opiates can be made from the opium poppy plant, or they can be produced in a lab, for example, fentanyl. Even prescription painkillers can lead to serious side effects and can even lead to addiction and dependency, especially when not taken as prescribed by your doctor or if taken for prolonged periods of time. So to answer your question, what has attributed to the rise in overdose rates? Well, I think that we can point to two things that have clearly created an impact, and you said one of them in your introduction, the uptick in fentanyl hitting the market. So you had mentioned that it is currently present in 80% of overdoses on Staten Island as compared to in the early 2000s where it was only present in 2%. So, you know, we're going to talk more about what fentanyl is later, but fentanyl is a synthetic opiate that is highly potent. It is 50 times more potent than heroin and approximately 100 times more potent than morphine, and it's being found in our drug supply. And another thing I think was COVID, right? So we started to notice a decrease actually in overdoses between 2016 and 2019. We went from 112 in 2016 to 94 in 2019, and then from 2019 to 2020 it went from 94 to 133.
And that's just on Staten Island.
And that's just on Staten Island alone. And so that jump from 94 to 133 is, I mean, any number of overdoses unacceptable, but to go from 94 to 133 in 1 year alone is just completely unacceptable. And it's no coincidence that this happened the year after COVID, right? In 2019 from 2020 is when we noticed this spike. And what COVID did and what we saw in the clinic, you know, people were feeling very depressed, they were isolating, they were feeling anxious, quite frankly, they were bored. And I know that they, you know, weren't coming into the clinic with the availability of telehealth services. People stopped coming in person to the clinic. And one of the things that we do is we test our clients. So the drug tests, the clients really hold themselves accountable. And so we lost our ability to do that. So I think that we're still, even years later, trying to catch up from the effects of COVID. And so to answer your question, just to summarize, those are the two main things that we can clearly point at, the uptick in fentanyl and COVID-19.
Did you find that the people that were coming to you for assistance after the pandemic, were they known addicts or these were new addicts?
Both. So we were finding that current clients were not being as forthcoming about their use during COVID, right? Because as I said, a big part of our job is to see clients in person and to, look at their affect and see if they're intoxicated. And so by not coming in, and even like through telehealth, that there's a lot that is not seen. And so we were seeing, but then, right, so then after COVID and people started coming back in more, we did see a rise in referrals because people, I think, realized like, I need to get help. This needs to stop, right? So.
And fentanyl is mixed with the opioid, correct?
Yes.
Okay,
Yes.
so is there been a change in the, I'll say, drug of choice before the pandemic to now?
Well, I would say that opiates have been an issue for a while. That's not new. So in terms of drug trends, most commonly we see people coming into the clinic with a history of using opiates, alcohol, cocaine, benzos. Those are all big issues. But what we're seeing in terms of drug trends of fatal overdoses on Staten Island is that 53% of overdoses are cocaine related. So cocaine numbers are up almost 20% between 2021 and 2022. And the majority of cocaine overdoses are drug mixtures. So people are mixing central nervous system stimulants like cocaine with a suppressant like heroin or fentanyl. And this is a dangerous combination. Some people who are mixing drugs are doing this knowingly. They are, taking cocaine and also using heroin, while other people who are using cocaine, that may be their only drug of choice, and they're not aware that their cocaine has fentanyl in it. So cocaine users are at higher risk of overdose, right? So if I'm a heroin user and fentanyl is in my drug supply, it's still dangerous, but even more dangerous for someone who is a cocaine user who doesn't already have that, tolerance for heroin. So we're finding cocaine is a bigger issue, and that fentanyl is everywhere. It's being mixed in ketamine and even counterfeit benzos. So, this is a good kind of segue into talking about what fentanyl is also. So fentanyl is a synthetic opiate. It was originally developed as a painkiller for surgery, and it can be used for end-of-life care. I said that fentanyl is 50 times stronger than, more potent than heroin, and 100 times more than. I also wanted to mention that fentanyl used on Staten Island is not manufactured or even produced here in the United States. It's illicitly manufactured and internationally synthesized in China, India, and Mexico. And it is transferred to the United States as pressed pills or powder. And most of the New York City supply is brought through the Bronx and distributed throughout New York. Fentanyl is both sold alone, and it's often used as an adulterant because its high potency allows dealers to traffic smaller quantities but maintain the same effect that buyers are expecting. So manufacturers are also adding bulking agents like flour or baking soda to fentanyl to increase the supply. So as a result, right, it's more profitable to sell a kilogram of fentanyl as opposed to a kilogram of heroin. And so that's why, we're also seeing it being mixed for that reason. But unfortunately, fentanyl's high potency also means that even just a small amount can prove deadly.
And fentanyl is not the only substance that's out there. There's another one, Xylazine?
Yes,
is that what it's called?
yes. So Xylazine, commonly known as Tranq, is not approved for human use. It is FDA approved for use in animals. Veterinarians use it to sedate animals before surgery. So it's used in animals, cattle, sheep, dogs, horses. Like you'll hear people say Xylazine, that's a horse tranquilizer, because it literally is a horse tranquilizer.
Wow.
in terms of drug trends too. Xylazine is something else that we're finding in New York City drug supply. Xylazine can cause drowsiness, amnesia, reduced heart rate, reduced blood pressure, breathing, and to dangerously low levels. And when mixed, so it is a suppressant, and when mixed with another suppressant like fentanyl or heroin, it can lead to overdose, right?
Are you finding that the opioid usage on Staten Island, is it confined to certain zip codes, certain neighborhoods, or is it really all across the island?
The drug crisis on Staten Island impacts all neighborhoods, zip codes, genders, ages, socioeconomic brackets, right? So it's widespread, but we are finding in recent years the biggest impact of these deaths are in communities of color. Neighborhoods such as Port Richmond and Stapleton, St. George reported overdose rates far above the citywide average, with the 6th and 13th highest rates in the city. In terms of age, so in 2023, 155 people overdosed on Staten Island. The lowest age bracket is between the ages of 71 and 80 at 1%, and then under 20, 1%, but the other age brackets, pretty much like 20% in each age bracket, right, is what we're seeing. Gender, it's 70% male and 29% female, right? So more males are overdosing. And there could be biological, behavioral, or social factors that make men more vulnerable to overdose deaths. It may be that men use drugs more frequently or at greater doses, or there may be protective factors among women that reduce their risk of overdose.
And what kind of services are being offered at the Silverene Clinic to combat this addiction crisis here on the island?
So the Silberstein Clinic is an outpatient clinic. We serve individuals 18 and older who are seeking treatment for substance use and co-occurring mental health disorders. And I say co-occurring mental health disorders because, let's face it, to have a substance use disorder is to have a mental health disorder, right? Very rarely do I see the substance use occur in isolation. Most of our clients are also dealing with symptoms of depression and anxiety, and even psychosis. Sometimes drugs may induce psychiatric symptoms, so you have substance-induced psychosis. You have someone who reports that they are depressed, they smoke marijuana every day. Could it be the marijuana that's making them depressed? You have people that talk about having rapid speech and manic thoughts, and they're using cocaine, so it may be, could it be the cocaine that you're using that's causing that? So we have to rule out substance-induced so that then we can treat. If in fact it's not the substance that's causing it, then we can treat the psychiatric condition with therapy or psychiatric medication.
Well, it's wonderful to know the services that you're offering. And as you can see, we have a problem on the island, but it's good to know that you and your team are standing by. When we come back, we're going to go into the second segment of RUMC Vital Signs, and we'll be talking about another program offered at Richmond University Medical Center called Project Launch.
Hey, boss. Okay?
Yeah, I'm good.
You sure?
I said I'm fine.
Since I was little, it was only like me and my parents.
You think you created family out of characters?
Yeah, of course.
I'm gonna take that, make it into a song.
Put me to bed, see you in the morning. With the frosted Superman, but it wasn't on it. And we lost it. In my head, in my head, in my head. Where you at, on the way out? In my head, in my head, in my head.
Hey, son.
Hey, Pop.
You can talk to me.
It's been really, really hard for me.
And we're back. Thanks for joining me for this episode of RUMC Vital Signs. Since 2019, RUMC has offered a unique program for families along the North Shore of Staten Island. Project Launch is a first-of-its-kind program that offers families the opportunity to have their child assessed for physical and behavioral health conditions before they begin school. This way, children can start their school lives ready to succeed alongside their peers. Here to tell us more about Project Launch is the project's clinical director, Miriam Prat-Jerez. Welcome to the show.
Thank you. Thank you for having me.
Thanks for coming on. So tell us more about the program and tell us more importantly, who qualifies for it?
Sure. So it is a 5-year grant via SAMHSA. So it's federally funded, and we are actually in year 5, quarter 1. So we're wrapping up the project, and it's been a ride. The families that qualify for it are any caregivers or parents in the North Shore of Staten Island. The way that we define the North Shore is any residents that are north of the expressway. So if you look at the map of Staten Island, anything above the expressway, what we define as North Shore. And the caregivers, they don't have to be parents. They can be, not biological parents, but anybody who is involved in the care of a child who is 8 years old or under. We're also working with expectant parents as well.
And what are the components of the program?
Right. So you mentioned behavioral and physical health, right? So we do have a medical component. We partner with our pediatric clinic at 800 Castleton, and they provide a lot of the different medical assessments that are necessary for children who are falling behind in their milestones, and they identified early what are some of their needs and link them up with services. So our medical providers are trained in some of the specific needs that early childhood can present with, and they are aware of the different services that they can be referred, like speech, OT, and anything else. We also work with a developmental pediatrician who can do a full evaluation and work towards a diagnosis of autism if it's necessary, or any other developmental delays. We also have the behavioral arm, which is our clinical services. So we are able to provide behavioral health services, therapy for children, families, and expectant parents or parents alone through our program as well.
So this sounds like a very thorough, multifaceted program.
It is. We have a comprehensive approach to wellness. So our overall goal is to make sure that children can enter school ready to learn. But how do we do that? We do that by looking at the entire picture of a child. You cannot work with a child without working with the family and working with the community. So when we treat children and we approach wellness in children, we have to look at the whole picture. So we look at how they're growing, how they're developing, how they're behaving in their social emotional development, how parenting is happening in the home. We're also looking at how they're meeting their milestones in academics, and all of those aspects that go into child development in the early years. We go up to age 8 as they start really their academic careers at that time, but you can see those challenges coming through at age 1 or 2, and we try to intervene early so they can be successful and on par with their peers.
So you mentioned these challenges that you're finding in the lifespan of the project. Have you identified trends that are common across Staten Island?
Yes, so particularly for consumers or residents of the North Shore, if we know the demographics of the North Shore, it's primarily minorities and underserved and marginalized communities. So a lot of those individuals are struggling with risk factors related to social determinants of health. So what we have noticed in terms of the characteristics of those individuals is that they tend to be diagnosed with behavioral health problems at a higher incidence than other demographics on the island. So through our evaluator at NYU, the project has identified that most of our parents of the children that we serve have at least 2 chronic conditions diagnosed. This could be medical or psychiatric. So it could be hypertension and depression, or it could be depression and anxiety, but they do have a higher incidence of diagnosis. We're also seeing that consumers of the project tend to utilize emergency services a lot more than preventive services. And we've tried to identify the factors for that and the reasons behind it. And it's a combination through our qualitative data that we have gathered of mistrust of some providers or feeling misunderstood. And we have been able to build that trust and build that engagement through our efforts in Project Launch and bring them in and educate them on preventive services, meaning going to the pediatrician, regular checkups, engaging in their physical health activities, and promoting that trust in providers.
And how does someone who may be watching, who's interested in the program, how do you enroll in the program?
Right, so they can just reach out to us, and the phone number is 718-818-6715. They can also find us through the RUMC website, or they can come to our location and walk in at 669 Castleton Avenue. When they are enrolled in the program, we provide a battery of assessments, and we assess not just their psychological needs or behavioral health needs, physical needs, but also their social needs, such as housing, financial assistance, or any type of other assistance that they might need. And we link them up with providers. We have built a lot of resources in the community that have helped us to provide that support to them. And after we do a full assessment, we present them a menu of options and referrals for them to choose from, and we link them up with the services, and then we provide some of the services ourselves directly.
So who are some of the community groups that are involved in Project Launch?
Sure. So we partner with the Staten Island Alliance, the Staten Island Partnership for Community Wellness. We partner with El Centro, Project Hospitality, Canva, and a number of organizations that can help us address some of the social needs that our clients have. A lot of other organizations, faith-based organizations, actually provide us with clothing and other resources for families, sometimes coats and shoes that are not readily available or covered by grant funds.
And since the program's inception, roughly how many families have been helped through the program?
Nearly 500.
Wow, that many.
Yes.
Wow, that is fantastic.
Yes, and we're very proud of it.
So I guess you would say the program is a success.
I would say so, yes, yes.
So I know one of the most important tools that you have in the program is you actually have a van that goes out into the community. Tell us a little bit about the van.
So this was a very innovative idea that SAMHSA was very excited to promote and to actually fund for us. So the van represents the in-reach in communities, being able to break down some of those barriers for access to care that really affects underserved and marginalized communities. So the van allows us to reach the community members in their homes or in their neighborhoods, those who cannot travel. And imagine a mom who just gave birth, who may have multiple children. We're able to come to her home and provide our care, not in her home, but in our van, which is a mobile office. We can do education, we can provide behavioral health services, screenings, assessments, and all sorts of different services in the van. We also use it to deliver some of the resources that we get. So if we get clothing, or we get food, or we get formula, we are able to bring it to them. And it's very inconvenient, and it breaks down some of the barriers that families are.
Are you determining sites that the van goes to, or are you being get requests from community groups or elected officials?
Both, yeah,
Really?
and everything, yes. So wherever they ask us to go, we go.
Now, I imagine when you got when you got involved with RUMC, this was not a program that was currently existing?
No,
Okay.
no. So Staten Island Mental Health and RUMC merged in January of 2019, and the award from SAMHSA for Project Launch came in September of 2019.
And as you were putting this program together, I mean, can this work? Or this was like, wow, this is an exciting opportunity? What was the feeling? Because anytime you take on something new, you're like, well, this could work, it may not work.
Many times I ask myself, what were they thinking? Because it's a huge project and it's innovative. But looking back, it's been transformative to not just the community that we serve, but also the philosophy of treatment and how we approach work with families. It has really shaped a lot of our perspective and how we reach them. But it was definitely massive, and it was awarded right before, 6 months before the pandemic. So we had to really adjust to the changing needs of the community and how to deliver services in the middle of a pandemic as a hospital. So it was definitely challenging, but we have grown tremendously, and it's changed profoundly how we deliver services and our philosophy to care.
Can you tell us a little bit about some of the changes you had to make because of the pandemic?
Right, so a lot of the families did not want us coming in person. They did not want the van. Pediatric clinics did not want us to come in. Labor and delivery, baby and mom units did not want us to come in. And that's where we're planning of making those connections. A lot of our community partners were remote, so it was hard to bring them out for our events. It was how to reach them in a way that felt very connecting. But we adjusted, and we expanded our services via telehealth, assessing risk, and also imagine delivering therapy services to a 5-year-old via telehealth.
Sure.
Very challenging, but we were able to entrust families that we were taking their health very seriously, and through all of the RUMC measures in delivering services in person, with all of the infection control practices that we put in place, we were able to deliver services and get families to trust that they were safe coming in.
So you get handed a new program that you don't know if it's going to work. You get faced with a pandemic, and in the other side of this, you come out with helping almost 500 families.
Yes.
How does that feel?
Great, and I had 2 babies in the process, so it's pretty great. Yeah, we actually, a fun fact of Project Launch is we've had 5 babies in the 5 years of the program. The staff,
Really?
yes,
Wow.
It's a very fertile program.
Do you stay in touch with some of the families? Have you actually seen
Absolutely.
the progress?
Yes, absolutely, and they actually refer families to our program, and we've done a lot of qualitative interviews with them as well, and they have positive things to say, and we really focused on empowering parents. We want to graduate them from the program with skills and being able to utilize them in their life to have better outcomes and have more satisfaction. So we don't want them to stay with us. We want them to graduate and be able to be successful. So our empowering parents has been the mission and what we wanted to do.
And in our closing moments, if someone is watching this episode and wants to enroll in the program, I know you said the number before, how can parents find out more about Project Launch?
They can go on the RUMC website, and then SAMHSA also has information on Project Launch, or they can call us and we can talk to them about the different features of the program.
Great.
Yeah.
Well, thanks, Miriam, for joining us and providing
Thank
such
you.
an important program, and I'm glad to hear that it was such a success.
Thank you so much for having me.
I also want to once again thank Ileana Acosta for joining us earlier in the episode. Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for nearly 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the donate button located at the top of the homepage, or you can call 718-818-2106. In the meantime, that just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.